an episode that we emergently placed for those who are interested to learn scientific facts about coronavirus, but also spiritual and religious information. I will call this episode Corona Universal Timeout, Fear or Faith. The world is currently experiencing a pandemic of a virus called Corona, which is Covid19. It's caused by a family of coronaviruses, and this syndrome is called coronavirus 2, SARS-CoV-2. Coronaviruses are notoriously to be transmitted from animals to people. This particular strain, the type 2, is thought to be originated from some seafood market in the city of Wuhan in China in late December 2019. The symptoms of COVID-19 resemble that of common cold: fever, cough, and shortness of breath. However, the infection can soon lead into pneumonia, multi-organ failure, and acute respiratory distress, or what we call ARDS. The elderly and those who have pre-existing chronic health conditions usually present with much worse presentations of COVID-19. As of March 20, 2020, there had been cases infecting 160 countries across 6 continents. By far, China has been the country most impacted by the disease. As of Friday, March 20, there had been a total of 244,523 cases of COVID-19 worldwide. 81,199 of these cases found in China. However, the total number of COVID-19 cases and deaths in the rest of the world has now overtaken the total number of cases and deaths in China. While the number of new cases in China has stabilized, there had been an increasing number of new cases in many other countries and regions around the world. Every country in Europe has now reported at least one case, with Italy the hardest hit, the first European country to place all of its citizens on lockdown, restricting travel, closing schools, closing public spaces, and canceling all public events. Soon after, Spain, France, and Germany have reported the most cases in Europe besides Italy, with these countries and many others in Europe have been also closing schools, canceling public events, and so forth. To give you some statistics, as of March 20, 2020, the pandemic had killed more than 10,000 people worldwide. The number of confirmed COVID-19 cases is rapidly climbing. 14,000 cases are known now in the United States and 247,000 cases globally. What you see now in this graph, the rapid rise of the cases that you can see in the United States of America. This bar graph shows you that New York now has the highest number of cases in the whole United States of America and rapidly accumulating number of cases, followed by Washington State and California, then New Jersey, and a slew of other states. 2 belief bills have already been passed and signed. Unveiled by the Senate Republicans on March 19, 2020, will now be debated. It includes rebates of $1,200 for most individuals who reported less than $75,000 income in 2018, or $2,400 per couple who filed their taxes jointly and made less than $150,000 in the tax return of 2018. Let's talk about other pandemics. In the history, we called it plagues. Perhaps the most famous plague in the history is what we call the Black Death of the 14th century. It's thought to be called also the bubonic plague. It's estimated more than 20 million people, a third to half of Europe's population, died in that outbreak. In 1346, it was reported that Europe had a devastating disease from China that was affecting many parts of Asia. Another pandemic occurred 80 years ago. A sudden mutation of an influenza virus was worldwide called epidemic, and in 18 months killed about 25 to 40 million people around the world. Some called it the killer flu. What are the symptoms of coronavirus? These symptoms appear 2 to 14 days following exposure: fever, cough, and shortness of breathing. If anyone develops other warning signs, like those emergency signs, need to immediately report to a medical facility. Difficulty breathing or shortness of breath, persistent pressure in the chest, confusion or inability to be woken up, bluish lips or face. Now, what do we do in a medical sense? The first thing, protect yourself. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been in public places, or after blowing your nose or coughing or sneezing. If soap and water, you are outside and you don't have them. If you were outside and you don't have soap and water, then use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them all together until you feel dry. Avoid touching your eyes, nose, and mouth with unwashed face. Number 2, avoid close contact with people who are sick. Put a distance between you and other people who may have COVID-19 in your community. That's especially more important for higher risk people like older adults over the age of 65 who have serious underlying medical conditions like diabetes, heart disease, cancer, or lung disease. Number 3, protect others. Stay home, please, if you are sick. 2, call your doctor if you think you have been exposed to COVID-19 or you are developing fever and symptoms such as cough, shortness of breathing, and at that time you need to call your healthcare provider. What are the steps to help preventing the spread of COVID-19 if you are sick? The most important point is stay home. People who are mildly ill with COVID-19, if they can stay home, they usually get better on their own, and they avoid infecting others. Stay in touch with your doctor. Call before you get to the medical care facility, just in case if they are closed. Avoid public transportation as much as possible. Home isolation. This is very important. Stay home from others. As much as possible, you should stay in a specific, what we call a sick room, and away from other people in your home. Use a separate bathroom if available. I am talking those who are infected and staying home. They should not wander all over the places in their houses, but stay in what we call a sick room and use only, if possible, your bathroom. Limit contacts with pets and animals because they may also transmit the infection to others. Wear a face mask if you are sick. You should wear this face mask when you are around other people and before you enter a healthcare provider's office. If you are caring for others, if the person who is sick is not able to wear a mask, for example, he or she are short of breath, then people who live in the same household should stay in a different room, but should they care for him or her, they have to wear masks. Cover your cough and sneezes. You have to cover your mouth with your elbow or with a tissue which you have to keep inside your pocket. Wash hands immediately after you cough or sneeze for 20 seconds. Clean your hands often. As I mentioned, wash your hands, hand sanitizer, soap and water, and avoid touching your face. We always speak about sharing. This is the time of do not share. Do not share dishes, drinking glasses, cups, eating utensils, towels, bedding with other people in your home, especially if you have any signs of these infections. Wash thoroughly after you use any of these things that were used by an infected person in your household. Clean high-touch surfaces every day. Clean and disinfect those what we call the sick room. If the sick person can clean his or her room, they should do that every single day. If you have, as a caregiver, you have to clean after a sick person in your house, then you yourself should be always wearing a mask and should clean after any area that the sick person have used or touched during his or her time in the house. High-touch surfaces may include phones, remote controls, counters, tablets, iPads, doorknobs, bathroom fixtures, toilets, keyboards, and other things. Clean and disinfect any area that could have a blood, stool, or other fluids stains. You must disinfect any area that could have been touched by bodily fluids from a person he may be suspected to be infected in your household. Monitor your symptoms. Watch out for your temperature. Watch out for your cough. Watch out for your shortness of breathing. If any of these symptoms are getting worse, you must seek medical attention, but call first, just in case if this medical facility is closing or do not have spaces to be seen. Wear a face mask on your way to go and avoid public transportation. Now, God willing, how to discontinue home isolation. People with COVID-19 who have stayed home can stop home isolation under the following conditions. If you will not have a test to determine if you are not anymore infected, then you must have these conditions. You must have no fever for at least 72 hours, 3 full days, before you actually become part of the community. Other symptoms must have improved. For example, when you were coughing or short of breath, now you don't have these symptoms anymore for at least 72 hours. At least 7 days have passed since your symptoms first appeared. So if you start getting symptoms of infection on Monday, you must wait 7 days from that Monday and 3 days after the end of fever, the end of cough, the end of shortness of breathing. If you can be tested, then you need 2 negative tests before you are pronounced not contagious. And you should again have no fever, cough, or shortness of breathing for 3 days prior to become part of other people's lives.